So when we're talking about the lumbo-pelvic hip complex, we came up through the quadricep, we crossed the hip joint obliquely. We've talked about this band, that 2-inch band, that strip around your body that we're going to address. We talked a little bit about the deep 6 lateral rotators. We've talked about the adductor complex for Magnus. Let's just touch on the other adductors. Now for the other adductors, depending on the height of the person, these larger foam rollers might be a little bit uncomfortable. It puts them in a position that's not anatomically comfortable. For me, I tend to like this larger roller for the adductors because I can just drop or relax down and let the weight of my body or weight of my leg do the work for me, where I don't have to hold that iso abs position. So we've talked about addressing just above the knee complex, but come through the muscle belly. Come all the way up towards the proximal aspect. You're not just getting the adductors, you're getting part of the medial hamstrings, you're getting part of the medial quadriceps. And once you're all the way up at the top, this might look a little weird, but let the femur relax. Get the pin and stretch away. Open back up this way. And I'm doing this a lot faster than you need to. I'd like you to get into one of these spots, hold that fascial pull for 2 or 3 minutes, and have some big changes. You can even begin to move the adductors in a position that you want, put a little stretch on them, get in through the belly. A lot of times when I foam roll, I'll use 2 or 3 rollers at a time because I get tired. I know I should have better core stability, right? I'll put one right under the ribs so I can just hold my body up. I'll put a pillow under my chest. I'll have one on my head. So if I want to really release the adductors, I'm here and I'm hanging out for a long time. So don't be afraid, especially with a set like the relaxer, when you can kind of hold yourself up, or I use other rollers, any size rollers. If you want a little bit more bite, you can use this roller. Is going to have a little bit more density. I can prop myself up here more. And think of that cylindrical approach. I want you to begin to think of separating. Let me grab the little green pad here. I want you to begin to think of separating the tissues, understanding the layers of anatomy, understanding origin, insertion, action, understanding how they intertwine with each other and on top of each other, and the fascial connections that you've got. So you're not just going up and down, you're exploring the cylinder. You're pushing in and separating, then and getting drags in different directions. As you learn more about the fascial bands or trains of the body, or the patterns that exist within them, you might learn to pull obliquely in one place, or you might pull a little bit more anteriorly, posteriorly in others. But releasing the adductor complex can be pretty powerful if someone's got dysfunction within the lumbo-pelvic hip complex. I see the adductor magnus, as well as some of the short adductors like pectineus and brevis, to be very overactive and aggravated on many people. So when we have weakness in the posterior fibers of glute medius as well as glute maximus, the TFL and the adductors really grab on to try to stabilize the iliofemoral joint in the pelvis. And when we're trying to go ahead and recondition ourselves, when we're trying to go ahead and balance off someone's lumbo-pelvic hip complex, we must address them. So I've set up today to start at the lower extremity and then move upwards. Think of coming up through the adductors. Think of exploring out through the outside of the hip, going all the way back towards the sacrum, the posterior iliac spine. I'm going to grab the tennis ball just as the tennis ball rolled away. I'll use the racquetball. Racquetball will work for me. This won't do too much, but any of the other balls that we talked about. But think of the triangle of the sacrum, working just laterally to that, just below the posterior superior iliac spine, working all the way out through the greater trochanter. So if I've got the greater trochanter and the iliac crest, I'm working all the way in through here. This is a wonderful area, anterior fibers of glute medius, all the way in through that. So you're working cylindrically through the body, just not up and down. Spend 10 or 15 minutes through this part of the body. You're going to stand up and feel completely different. It's going to prime the tissue for being mechanically lengthened with static stretching, or it's going to be much more receptive to any neural activation techniques or muscle strengthening you're going to do from there.